Good afternoon, everybody. I think we'll go ahead and get started. We are recording this session, so at the end you can go back and watch it. And for anybody that does hop on late, we will be recording it. My name is Chris Peltier. I am the president-elect of the Ohio chapter of the American Academy of Pediatrics, and I'm going to be your moderator for this afternoon's joint webinar with the Ohio Department of Health, really looking at logistics, answering questions on getting COVID-19 vaccinations into your office for children. Most of you know this has been a very important week. Earlier, the FDA had met and recommended that the Pfizer EUA for children be lowered down to age 12. And today, CDC and ACIP voted to carry that out. So beginning tomorrow, we will be able to vaccinate our 12-year-olds. There's also some other updates that we'll get to as we go throughout this webinar. So really, I'm going to introduce three speakers from the Ohio Department of Health who have been very, very helpful in working with us and trying to make this as easy, as seamless, and as painless as possible to get vaccines into our kids, initially beginning age 16 and up, and now starting tomorrow, age 12 and up. So I'm going to introduce our three guests from Ohio Department of Health, and I'm going to turn it over to them. We will be monitoring questions via the chat box, so please make sure you enter those. We will save the chat box, and get any questions we don't get to, we will be sure to follow up and send out with our email updates. First, I want to introduce Lance Himes, who, as many of you know, is the Assistant Director and Senior Deputy at Ohio Department of Health and is leading ODH's vaccination response. Lance has been with ODH for more than 17 years and served in a variety of capacities. Our second speaker is Antoinette Uhas, who is a public health nurse specialist for the immunization program, Bureau of Infectious Diseases at Ohio Department of Health, where she served for over the last year. She has over 20 years of experience in public health, almost all of those in a local health department. She also has pediatric nursing experience from Children's Medical Center in Dayton, Ohio for almost 10 years, and has almost 40 years of total nursing experience. And then our third speaker this evening is Bobby Craybill, who is also Deputy Director of Ohio Department of Health. And in regards to the state's COVID response, she is the channel lead for the local public health department vaccination efforts. Lance, I think you're up first, and I'm going to turn it over to you.
Thank you, Dr. Peltier. Really appreciate it. And I want to thank all of the physicians and pediatricians who have joined us tonight. Really appreciate you taking time out of your busy schedule to be with us and have us share a little bit more about this topic and see what we can do to answer your questions and help get vaccine into our youth's arms and get them vaccinated. So if we could go to the next slide, I'd appreciate it. Great. So we've been really focused. Let's go to the next. Yep, 3 is perfect. We've been very focused on vaccinations since the vaccines were approved in mid-December, but we're also very focused at the same time on key indicators, including cases, hospitalizations, ICU admissions, and deaths. And thankfully, all of these indicators have been really moving in the right direction, and we believe that's directly attributable to the success and the efficacy of the vaccine. Certainly, masks, social distancing, and hand hygiene have contributed, but the vaccine has just made remarkable impacts on our case numbers and hospitalizations. You can see here that the 21-day trend for all of these are fairly stable, and these are much lower than they've been throughout the pandemic since we started peaking again in late fall. So really, we're at a good place with these indicators, and the vaccine is just another opportunity to keep improving our immunity to COVID. So I wanted to touch base just with these statistics, first of all, just to level set before we jump into vaccines. Let's go to the next slide, please.
Hey, Lance, before you do that, can I just, or you can advance, but can I just make one comment? We just were, Melissa and I were on a national AAP call today, and just to kind of put it in perspective, although in general, I think numbers are slowing down. As of today, in the last week, nationwide, there were 72,000 new cases of COVID that were diagnosed in the United States in kids in the past week. 25,000 of those in the Midwest region. And nationally, over the past week, new cases in children, again, up to age 18, accounted for 24% of all new COVID cases. So I just wanted to sort of put some pediatric spin to that data that you're presenting.
Thank you, doctor. That's a great point. And that's where we have seen some of the increases in those younger age bands, including children. Absolutely. In terms of vaccinations, currently we've got over 4.8 million Ohioans who have had their first dose of vaccine, and just under that we've got about 4.3 million who've actually completed their vaccination series. So we're really making good progress, and with the expansion of 12 to 15 years of age eligibility, we expect more. You can see here the demographic age breakdown based on age. This is actually just a screenshot from the coronavirus.ohio.gov COVID dashboard. You can also sort by other metrics, but you can see here that the certainly the percentage of vaccine has been really administered in those age bands above children, including 16 and 17-year-olds who were previously eligible for Pfizer. But that's what we're here tonight to talk about, to see how we can increase those numbers. Next slide, please. I think just touching on the purpose, currently, I think as of this morning, or at least my last report, we have 56 pediatric practices who have enrolled as COVID vaccine providers. There may be more in process, but 56 had officially enrolled. And I know many of you probably already VFC providers. So we wanted to answer questions, provide information, to provide comfort and help answer any questions in terms of any barriers that you may have in terms of enrolling as a provider and receiving vaccine. Certainly, we have plenty of vaccine now. We are at a point where the demand is waning and the supply is increasing. So we have Pfizer available. We have Pfizer in our federal allocation that we have not yet ordered. It's sitting at the distributor and ready to order. And we'll go through a little bit later some of the ordering process, but it's fairly easy. I do want to mention that we currently this week, I believe 3 pediatric offices had indicated that they wanted vaccine. And I know many were waiting until ACIP and CDC and FDA took action to approve down to 12 to 15, including 16 and 17-year-olds. So now that we expect CDC approval tonight, after the ACIP recommendation just came out this afternoon, we expect that we will have CDC approval, and as Dr. Peltier said, we can start vaccinating those age groups tomorrow. But just going through some of the enrollment specifics we thought would be helpful. One other thing I want to share before I turn it over to Bobby Crable is that we are currently exploring, and I think we're going to make this happen. The Pfizer vaccine has come in 6-dose vials and in lot sizes of 1,170. We have been breaking those down at our warehouse into smaller lot sizes. We send them out in approximately 120 dose shipments to practices and to other providers. But we're going to go further than that because we know the volume may not be there initially. So we are likely to be announcing, and I think we're going to be sending out a letter, maybe even yet today, that we're looking at doing 30-dose shipments that we could send to practices. And that would be hopefully much more manageable for you. And certainly you could order more than that in multiples of 30. But I wanted to share that with you before we went further in the presentation. So with that, we're going to reduce other barriers, such as we previously required providers to be open to the public and vaccinate people other than their patients. That's gone. We'd previously tried to require the providers get through their vaccine in 7 days or less. Now we understand that this takes time, and the days of the mass vaccination clinic are kind of behind us, and it's going to be more of an education and personalized, comfortable experience at providers like pediatricians. So I just wanted to share some of those steps that we are taking to make sure that this blends with your practices and your patients. But really, my ask is that please consider becoming a provider. We really need your help. And we think that parents and children will both really appreciate having vaccine available at their friendly pediatrician's office. Bobby, I'll turn it to you. Thank you.
Thank you, Lance, and thanks to everyone who's attending this evening. You are such an important part of this vaccination effort in Ohio. And so when we think about vaccine eligibility for minors, just to recap, until today, Ohioans age 16 and 17 are eligible to receive their COVID-19 vaccine with consent from a parent or guardian, unless they're emancipated minors. And we know today, of course, that will expand to 12 to 15-year-olds in addition to the already eligible 16 and 17-year-olds. And so that's outlined here, and I think we can go to the next slide. We've all kind of grasped that today. Next slide. Oh, thank you. So with the COVID vaccine more widely available and the vaccine supply, demand, and administration strategies continue to evolve throughout this pandemic, the Ohio Department of Health has updated guidance for providers to address what might have been barriers to your enrollment in the past. And Deputy Director Himes outlined some of those, but I want to make sure that we go through some of those things that might have previously been concerns for you so that you understand we have changed some guidance and expectations. So again, providers are no longer expected to administer the COVID vaccine to non-patients, and you can schedule with your own patients only if you wish to do so. Conversely, if you are vaccinating your patients and you want to open up that vaccination opportunity to their family members, obviously we welcome that, but it is not an expectation. You can vaccinate only your patients if you prefer to do so. Again, there was some throughput requirement in the past that required you to administer vaccine quickly once you had received that. And we're understanding that that 7-day requirement for administering the doses once you've received them is not possible for all of the providers, and so that is no longer a requirement. You have some more flexibility in the time that you have to administer the vaccine received. Of course, we would ask that you do that as quickly as possible. I think that's a goal that we all have, is to have more doses out, but we understand that 7 days may not be feasible. And while every effort to minimize vaccine waste should be taken, we understand that that is not always going to be the case. And so practices will not be adversely impacted if you aren't able to use your entire supply. Also, ultra cold storage capability has never been a requirement, even for the Pfizer vaccine. Vaccines requiring cold storage beyond normal refrigeration capabilities are shipped in thermal storage containers that can be used safely by the provider following manufacturer guidance that's included with the shipment. You can read more about storage, handling, and administration of the Pfizer vaccine on guidance provided by the CDC, and we'll go into that a little bit later in this call. Next slide, please. So how do you enroll as a provider? There's a link here, and we'll make sure that you receive that after this call. But the requirements are provided on a website through ODH. And there are a couple of notes about that. That same website is used for enrollment. Only one individual needs to complete that enrollment per location. So that could be your office manager or someone else who you designate within your practice. And all providers at the practice site who are legally authorized to administer vaccine can administer the COVID-19 vaccine under that single registration. Next slide, thank you. And the currently available COVID vaccines, I'm sure that many of us have read up on this and followed the news. Of course, the slide is a few hours old already, so we can note that the age change for Pfizer will be 12 and up after today. And so we have 3 products. Currently, one is available to those ages 12 and older. That is the Pfizer product. Moderna is reserved for those 18 and older, and as is the Johnson & Johnson product. Those have not received eligibility authorization for anyone under 18 at this time.
Bobby, can I interject real quick? We learned
Absolutely.
from the national AAP sort of COVID team that in the very near future, Moderna is going to apply to expand their EUA to 12 and under, or 12 and older as well. We don't have an exact time frame, but they're going to be pursuing that soon.
Thank you. And also, just to recap, emergency use authorizations speed up manufacturing and administrative processes of vaccines. They do not impact development, research, 3-phase clinical trials, or the study of side effects and adverse reactions. So the FDA closely monitors each vaccine for safety before and after that emergency use authorization is issued. Presently, the COVID vaccines have not been approved for full FDA licensed approval. Pfizer has applied to the FDA for full licensure, and Moderna is expected to follow that in the coming weeks. But do note that that review process could take months. Next slide, please. And so once you're an enrolled provider, how does the vaccine ordering and shipment process work? We'll just walk through that. And again, you'll have access to the recording of this meeting if you would like to review that afterward. The federal government notifies Ohio about its statewide allocation for the vaccination program on Tuesdays of each week. The federal retail pharmacy program is allocated separately, and that's not managed through ODH. So where pharmacies are receiving shipments under that program, that is managed directly between the federal government and those pharmacies. So after we receive our notice on Tuesdays, we allocate the vaccine to enrolled providers across the state. And an email is sent to the providers that would alert you when to expect the shipment for the coming week. And it includes approximate timing, which can also be viewed within VOMS, which is the vaccine management system. So providers have access to view that there. And weekly shipments arrive on Mondays, Tuesdays, or Wednesdays. Also to note that you'll receive ancillary kits that are shipped separate from the vaccine, but arrive about the same time. And those include syringes, alcohol pads, the vaccine cards, a chart that describes the needle gauge and length recommendations. The kit also includes 2 face shields and 4 surgical masks. And those arrive typically the day before, or even perhaps the day that you received the vaccine. Next slide, please. And so let's talk just a minute about ordering vaccine. So the Ohio Department of Health is assigning doses and placing orders for most of our providers. And again, providers are notified about their allocations. That comes out on Wednesday prior to the time that you'll receive the vaccine, which would be again the following, like Monday, Tuesday, Wednesday. There are some vaccine providers who have piloted and are now participating in our first phase of direct vaccine ordering. Those are our local health department and hospital partners. And so as we really kind of move into that a little bit farther, we make sure that that is working well for those providers, and vaccine continues to be more widely available. Our goal would be to transition to an ordering process for all providers. But currently we would work through more of an allocation and assignment process with our medical offices. And with that, I will ask Antoinette if she would pick up from there and talk a little bit about what this looks like within your practices.
Okay, everybody, buckle up and let's go rolling here. Okay, here are some of the best practices ODH shares with all new vaccine providers to plan their clinics. This information is going to help you prepare for large-scale vaccination clinics or just even simple ones that you have on a regular basis in your office, or even off-site ones that you might have partnered with a school. So these are some wonderful guidelines that we need to share because the pandemic is still happening and there are lots of planning and issues you've got to have in place. So to have this come out real smooth for your clinics, you want to make sure you have necessities and additional supplies and logistics planning to keep staff and vaccine recipients safe and healthy. Now you're going to need a map to the flow of your clinic from where recipients enter to check-in, the demographic data entry area, to screening for any potential contraindications, to the vaccination area, and then the waiting recovery area, then final checkout and exit. Social distancing must be maintained throughout all steps in the process. And please utilize the CDC guidance on COVID-19 mass vaccination clinics as a resource. Now, think about additional staffing you might need, as well as necessary supplies like PPE, alcohol-based hand sanitizer stations set up throughout, signs and posters to guide your clients, and additional cleaning supplies. Can't clean those doorknobs and light switches enough. Now, how will you schedule your appointments? These are things to think about. Will you use an online system, schedule by phone? Will you take walk-ins? Will it be a drive-through? Will it be on-site, off-site at a school, church, or business? These are all considerations that you need to think of when you are planning these clinics. Next slide, please. Now, you want these clinics to be convenient and accessible. So you need to make lots of plans and lots of details. Good communication and sharing of ideas is always helpful. Now, how do you plan to handle inclement weather? This is Ohio. So do you have a designated safe area in case of a tornado? What will your clients do in that type of situation? Do you have plans in place for that? Will your clinic be outdoors? And again, there's lots of things you have to consider with having an outdoor clinic. How will your clients arrive? By car, bus, Uber? Will you have wheelchair accessibility? Do you have ideas how to handle clients with special needs? What about interpreters? Now, there's lots of detailed preparation that needs to occur so you can get vaccine into arms. Again, check out the ODH provider page and the CDC. They have great checklists and other resources for planning vaccination clinics. Next slide, please. You're going to want to keep your staff and clients safe, and this needs to be your foundation in all your clinic preparations. So again, you want to screen your clients coming in. Anyone that has symptoms of COVID, you will be turning them away. We don't normally in our vaccination clinics, it's okay for them to have a little bit of a cold, but with COVID, even asymptomatic people can show up and you don't know. But again, keep the limit of people in your waiting area. Think it through. What's the size of your rooms? How many people can you accommodate and practice social distancing? Mask requirements, for people over the age of 2. Hand sanitizer stations. Make sure it's alcohol-based hand sanitizer, at least 60%. And that social distancing, whether you have to put markers on the floor, anything to help out. Next slide, please. So safety, safety, safety. Okay, one thing you also need to be aware of is for your staff that's going to be administering. Okay, they need to have their PPE on as well. You know, face mask, eye protection. Now, gloves are not required because the COVID-19 vaccines are intramuscular. Gloves are optional. Now, if your staff has a cut or wound, yes, they should wear gloves. And if they do choose to wear gloves, you got to change them between each person they're vaccinating. And you also need to use hand sanitizer in between each client that you see, because sometimes you're in a situation where hand washing is not accessible to a sink and soap, so hand sanitizer. Next slide, please. All right, so before the vaccine arrives, okay, you've got to get the responsibility of proper storage and handling down. So you are going to select a person, and this person will be your vaccine coordinator. And you're going to want to have a backup person for that role as well. So when your vaccine coordinator is off duty or they're tied up with something else, you've got a backup. Now, their responsibility will include, but not limited to, training staff on how to receive and store the vaccine, what to do for a power outage or equipment failure. They're going to know how to pack out the vaccine to keep it safe and maintain that cold chain. You're going to transport it to a pre-designated facility. So you're going to make arrangements with someone else, whether it's a local hospital or you have another provider that's just across the street. And if your power goes out and theirs is still on, you want to move that vaccine as quick as possible. Now, another duty that your vaccine coordinator is going to do is twice a day, staff's going to need to monitor and record temperatures of your storage units or refrigerators or freezers. Now, they'll respond to temperature excursions and they will contact ODH and vaccine manufacturers, if warranted, and they'll keep inventory management along with the rotation of the stock. Now, how to arrange your vaccine for storage is really important. In vaccine storage units, you do not want to use the shelves on the doors. You want to have space allow air circulation and airflow to keep the temperatures consistent in that refrigeration unit. Now, please use the storage and handling toolkit for guidance. Lots of great information in there. Another thing you can find on our provider page, and please visit our provider page. We've got so much information on there for you that's so helpful. One is a do not disconnect sign. You are going to want to have that and place that where your units are plugged into an outlet to prevent someone from unplugging your unit. There's a download of this and other signs too that you can find on our webpage. Next slide, please. Okay, temperature monitoring device. These are going to become your new little best friends. So to become a COVID-19 provider, you agreed to have a temperature monitoring device that meets the minimum requirements. So number one, it has a sensor or a temperature probe. Number two, they have an active temperature display that can be easily read from outside the unit and can display the current and maximum temperatures. Now, reset functionality of the minimum maximum temperatures, an alarm for out of range temperatures. Now, it's really important to place the sensor probe in the central location of your storage unit for optimal accuracy of your temperatures. You don't want it high and you don't want it low. You want it right in the middle. So kind of like Goldilocks. You want it just right. Okay, next slide, please. Now, before your vaccine arrives, you're going to need to monitor the temperatures of your storage unit to make sure it'll maintain proper storage temperatures required for the vaccine. Now, please see the ODH vaccine provider page under temperature monitoring excursions for available downloads of printable temperature logs. Now, you're going to be logging temperatures and the minimum, maximum temperatures each day on these little paper logs. Next slide, please. Now, the standards for daily temperature documentation. Now, these, I encourage you to make them as fun as possible because you want to mark off the days that you are off, because you are not responsible for coming in on your day off to monitor the temperature. So mark those days off, but when you come in, when your facility opens, you want to get that temperature, you want your minimum, maximum, and then you're going to clear that temperature log. You're going to want to write down the exact temperature, the exact time you took the temperatures as well. Don't just put AM and PM. Put the actual time. This is going to help you out if you run into troubles. We'll be able to know when you really did your recordings. And at the end of the day, you can do the same thing. You will check your temperature, you will mark it down, record the time, and you're out the door. And again, make these as fun as possible. I had mine by the seasons, just to make it fun for staff. Next slide, please. Reporting temperature excursions. It is so important to call ODH immediately upon discovering an out of range temperature. First thing you want to do is, well, besides screaming and panicking, first thing you want to do is put a do not use sign and date and time and put your name on it so no other staff member is going to be using that vaccine if you are on the phone with ODH. That way, everything is all safe and secure. Now, this is a dedicated provider call line number. You are going to want to write this down, ingrain it in your memory. 1-844-963-4829. And that's Mondays through Fridays from 8 to 7, and on the weekends, 8 to 5. Okay, we do staff it. So please give us a call if there's any problems, any issues with temperatures. And when you do call, if you do have to, an ODH staff member will review your data with you to determine the next steps that you need to take. You're going to need your temperature data and the temperature logs, and you will be sending those to the ODH staff member. Now, ODH will determine if a site must contact the manufacturers as well, and if the vaccine is still viable or must be wasted. Next slide, please. Now you're ready for your vaccine to arrive. But what do you do when your shipment arrives? Well, when it arrives, you must immediately check it out, assess and make sure it is properly stored. Inspect the boxes for damage. Look at the temperature monitoring device inside the package to determine if there were any temperature excursions during the shipping process. And a temperature excursion is any temperature reading outside the ranges recommended by the manufacturer. Now, if that checks out, hey, you're ready to go. You're ready to move the vaccine into your storage unit, or if you are choosing to use the thermal shipper as your storage unit. So if you're using a freezer or ultra cold freezer, be sure to place the vaccine in the unit to allow air circulation. Okay, you don't want the vaccine to touch the sides of the walls, and you don't want to use the storage shelves or the doors. And the drawers at the very bottom, you don't want to use those. You want to keep it centrally located. Because the areas on the doors and those drawers, those temperatures can be problematic, and that can make your vaccine not as viable. Okay, after you have put your vaccine away, you're going to go onto your computer, get into Impactcis, and go into the VOMS, Vaccine Ordering Management System, and you're going to validate the doses you received matches the doses that show up in your vaccine inventory. And this will show you lot numbers in your inventory, and the doses will decrement and coincide with doses administered. Now, we live in an imperfect world, so when you get your shipment in and you notice that the vaccine temperature has not been maintained during shipping, contact the provider call center immediately to report this. Timeliness is vital. Okay, so remember, sometimes ancillary kits arrive before the vaccine products arrive. Sometimes it's the same day, sometimes it's the day before, but they're pretty close. Next slide, please. Now, there are many storage options with your Pfizer BioNTech COVID-19 vaccine. Lots of choices. It's one of the most flexible as far as storage right now. You don't have to have an ultra cold. You can use regular freezer and refrigerator temperatures. So if you plan to use the ultra low thermal shipper for storage, you will need to purchase dry ice to replenish the shipper. Okay, now there's safety for staff is really important, so be sure and read how to handle dry ice to prevent injuries and destruction of property. You don't want to put dry ice down the sink, nor flush it down the toilet. If you want broken pipes, that will do it in a jiffy. Next slide, please. A vaccine transport checklist. We understand that there are times you will have to transport your vaccine, whether it is to an off-site clinic that you're using. It is vital to have the cold chain maintained at all times to ensure vaccine viability. So use the storage and handling toolkit to learn the proper packing of your vaccine. And don't forget your ancillary kits. It's great to have vaccine, but you gotta have the syringes and alcohol swabs to get them into arms. All right, next slide, please. Let's get into the meat and potatoes about the Pfizer BioNTech COVID-19 vaccine. Okay, it's a 2-dose series. It's separated by 21 days between doses. The spacing of the second dose can be extended up to 42 days. That's 6 weeks. Now, there's no data available for longer spacing, but completing the series is important, and you don't have to restart the series. Now, a dose administered at day 17 is considered valid. That's part of the 4-day grace period. Also, it's very, very important. Please use the normal saline without preservatives. It's the diluent that comes in the ancillary kit. Now, this diluent is only used one time, and then the remainder must be discarded. You're only going to remove 1.8 mils to then mix into the Pfizer BioNTech COVID-19 vaccine multi-dose vial. You will obtain 6 doses from each vaccine vial, and those doses are 0.3 mils each. It is vital. I can't say this enough. Do not shake your vaccine when you are mixing it. Do not shake it. There are wonderful videos on both the Pfizer website, and ours also has the links on the different techniques you use and the handling and care of this vaccine. Your messenger RNA vaccines are more fragile than the vaccines we're used to using. So please, please, please do not shake this vaccine. You also will need to protect this from sunlight. Your normal ambient room lighting is acceptable. That's not a problem at all. Another point of interest, do not cool vaccine overfill from multiple vials to make an extra dose. Do not do that. Please don't do that. If you have high dead volume syringes, that means they take up extra space, and so they will use more vaccine. You might just barely get your 6 doses, and that's it. You won't have anything left. If you have low dead volume syringes, you will get 6 doses, and you're like, oh, wait, I can get 0.3. There's a 7th dose. Don't do it. No. 6 doses is max. That is it. End of story. 6 doses from Pfizer. So again, please visit our provider page and familiarize yourself with the specific handling of this vaccine. And again, there are videos. Next slide, please. Okay, questions to ask before vaccination. Screening is really, really important. And there are screening tools, both from Pfizer BioNTech and one from CDC. You can use these or adapt for your agency, and additionally, you can brand it with your logo. But keep these screening questionnaires for at least 3 years. Screening is so important, especially with the teenage population. You will want to inquire what and when they last ate using an open-ended question. If you ask a teen if they had lunch, they'll answer yes. And if you ask them what they ate, you might get a different answer. You'll get a Mountain Dew and a Twinkie. They had at 11 o'clock, and here it is 6 o'clock at your clinic, and they haven't had anything to eat, and they just came from ball practice. I don't think that Twinkie and Mountain Dew are going to go very far. Syncope is quite common with the teen and youth. Teens are almost a little more squirrely than your kindergartners, and their anxiety is a lot higher. Fainting is quite common. Be prepared. Okay, next slide, please. And again, screening questions are important. It can help determine how long your patient needs to stay for observation after vaccination. Again, if they have allergies to dogs, cats, environments, latex, the biostoppers are not made of latex. So your children that do have shunts, they can be vaccinated without any troubles whatsoever. There's no latex involved. But people who have these type of allergies, yes, they can get vaccinated. People with history of allergies to oral medications or a family history of severe allergic reactions, yeah, they can still get vaccinated. That's not a problem. Now, people who've had immediate allergic reactions, we're talking some anaphylaxis here. Make sure it's cleared by the doctor that, okay, it's all right for them to get vaccinated. You might want these that have more severe and are more sensitive. You might want to have them go to a hospital facility, so they do have emergency equipment available immediately. And again, you don't want to vaccinate anyone that has any allergy to any of the vaccine components. And we do have listings of those. It's in the emergency use authorization. So be familiar with those so you can screen your clientele. All right, next slide, please. Now, preparing for possible allergic reactions. This is not fun to talk about, but if you're prepared, chances are it will not happen. Now, you want to have your rescue meds. You want to have your epi. You want to have your antihistamines. You're obviously going to have your stethoscopes and blood pressure cuffs, but it's also nice to have a pulse ox. That's great. Sometimes kids take a little while longer to recover. You want to make sure that they're still staying nice and pink. Now, teens especially, you want to have a minimum of 15 minutes and up to 30. Some people will have more of a reaction. And if they are going to have a reaction, it will be within the first 30 minutes. And they will tell you, their heart's racing. Some of it is anxiety, and some of it can be that they are having an actual reaction. But make sure when you are vaccinating that you don't have them standing. Make sure they're sitting down. Sitting down or laying down on the bench, especially if you know your kids. If you have one that's prone to fainting, go ahead, have them lay down right away. Get them comfortable. Have something to drink, have some snacks on hand. Next slide, please. Now, how to report to adverse events. Okay, VAERS, and you're all familiar with VAERS, Vaccine Adverse Reporting Systems, VAERS. It's an online system. You can go online to vaers.hhs.gov. There are two options to submit a report online, or you can download a writable PDF form and then upload when you're ready. And here's a word of warning, a word of caution. If you choose to submit online, make sure you have all your documentation ready, your patient's demographic and your birth date, things like that. You want to have that ready to go, because if you are interrupted, this site will time out after 20 minutes of inactivity and you're going to have to start all over. So make sure if you do have to report an adverse event, you want to make sure you have the time and you aren't interrupted and you're not multitasking, because again, it will time out in 20 minutes. Doesn't seem like a long time, but a phone call can go wayward very easily. What are you to report? Okay, death of a client or patient, regardless of the causality. You can vaccinate a person and 2 weeks later they are in a car crash and they die. They still want that reported. Okay, it does not matter if the vaccine was involved or not. There's no causality there. Okay, they also want you to report a life-threatening adverse event. So that's like anaphylaxis, the severe swelling of the face, neck, tongue, throat, lips. If you have an inpatient hospitalization or a prolongation of a hospitalization, you want to report that. Persistent or significant incapacity or substantial disruption of the daily ability to conduct normal life functions. So this would be like someone who just is so sore and so lethargic, they can't hold their head up. That would be reportable. Again, if you have clients that have given birth and there are anomaly in birth defects, by all means. But based on your medical judgment, anything that would jeopardize any individual or require medical or surgical intervention, you want to give those a report to VAERS. Okay, next slide, please. All right, VSafe. VSafe is a really cool program. It is connected to VAERS as well, but this is, it's a smartphone-based tool, and the recipients, they can opt out if they get tired of it, but it uses a text messaging and web system, and it surveys everyone. So you get your client to put on their smartphone, it's a free app. They will be contacted every day for the next 2 weeks to take a little survey. How are you feeling today? And they punch in the little answer, and this will go on. They'll go on for a month, and then they wait, and it'll be a 2-month mark and a 6-month mark that they will still follow up and say, oh, by the way, how are you doing? How are you feeling? And it's a way that we can gather data about the continual safety of the COVID-19 vaccines. So it's really cool and it's very easy to use. And like I said, if you get tired of it, you can opt out. Next slide, please. Reporting data through Impactcis. Okay, Impactcis is the name of our state registry for vaccinations. And if you have not enrolled, please, they hold webinars on a regular basis for new providers to learn the ins and outs of the immunization registry and how to operate bombs. And please watch for an invitation for the next webinar if you haven't already attended one. All right, next slide, please. And billing and reimbursement for the vaccine. Okay, now there will be no out-of-pocket costs for vaccine recipients. Now, enrolled providers, they may seek appropriate reimbursement from a program or health plan that covers your COVID-19 vaccine administration fees. And this would be like through private insurance, Medicaid, CHIP. Now, you might have recipients that don't have any insurance whatsoever, and you still want to seek reimbursement. There is a program through Health Resources and Services Administration offered by the U.S. Department of Health and Human Services, and it's based on Medicare rates that you'll be able to bill for. Next slide, please. Vaccine transfers. Okay, this is movement of vaccine is, we really don't want you to do that, but it is permitted between enrolled providers. It's got to have ODH approval, and there is a process for requesting vaccine transfer. We understand there are ebbs and flows. We are seeing a decline in uptake right now, but we are hoping with more and more pediatric providers and with a new 12-year-old age acceptance coming out, that's going to bring, stimulate more and more people to come, which is wonderful. Now, we recognize that there are circumstances in which you might need to transfer short-dated COVID-19 vaccine to another enrolled provider, to try and avoid waste. Now, the process for requesting a transfer. Okay, you completed COVID-19 vaccine request of movement, and it's an online form, and it includes submission of temperature documentation to ensure the vaccine viability. Okay, so you fill that out. ODH will review that, and they will also review your temperature logs to make sure there's not been any problems. And it's usually resolved within a day. And that's if you have no temperature issues. Now, if there are some temperature issues, it's going to take a little longer to sift through the data to make sure that that vaccine is viable. Now, you might know a provider, an enrolled provider, that you'll say, hey, my next door neighbor is Dr. Smith, and he's having a clinic tomorrow morning. I've got way too much. Can I transfer? That's if you know your provider. If you don't, contact ODH, and ODH will help you out in finding another provider in your area that can utilize that vaccine. And again, we want to stress the importance of don't miss an opportunity. If your day ends at 4 o'clock and at 3:45 you have a family walk-in of 3 kids, go ahead and open that vial and vaccinate them. We'd much rather you not miss an opportunity, and you are going to be wasting vaccine. That is okay. That is okay to do. We want to stress that. We don't want missed opportunities. Next slide, please. Now, how to contact us? Again, visit our provider page. There are so many resources for you. I've already given you the 844-963-4829 number, or you can also email us covidvaccine@odh.ohio.gov. So please, we are here to help. We are like your friend to phone, email a friend. We are here for you. We are so supportive and so excited to have you on board with us. So thank you for your time and attention. Back to you at AAP.
Thank you very much, Antoinette and Bobby. So just going to kind of, before we dive into some questions that I'm going to pose to both of you, this is just the link to our chapter website, specifically our COVID resources that you are available that have been out over the last year. So a special thanks to ODH for presenting and really making it a priority to get vaccine into pediatric offices. So a couple of questions that have come up either in the chat box or that we had gotten offline. So my first question I will address, and I'll answer that. There was a question about the 2-week sort of moratorium between co-administering vaccines 2 weeks before and 2 weeks after. That is, as of today, both the American Academy of Pediatrics, who at 5 p.m. put out a policy statement on COVID vaccination, recommended that that no longer need to be followed, and CDC also in a meeting today agreed with that. So the 2-week no vaccine before or after COVID vaccine, before COVID or vaccination is gone. So that is no longer an issue to barrier to either giving COVID vaccines or other routine immunizations like Menactra, HPV, Atacel, those things. So that is a barrier that has also been removed. There was a question, and I'll pose it to either Bobby or Anthony who wants to answer it, as far as consent and that form that I know the CDC has on their website. Does ODH have a preferred consent form that they would recommend we use, or should practices just go to the CDC website? And we can post that link in our post-meeting communications that you would recommend that practices use? And has it changed, or will it change now that it's 12 and up?
Hi, this is Antoinette. I'll address that. You can, it's up to the providers as to what they choose to use. You can use the Pfizer's screening tool or the CDC's. Either one are both excellent. And again, you don't want to vaccinate children that are unaccompanied by adults.
Great. And then the practices should just keep that internally. That is not a document that ODH needs back or anything like that, correct?
Correct. You need to keep it on hand. So if we do come and do a site visit, you want to be able to produce that
Right.
Yes, you are still screening.
Great. And then a clarification on billing. So when we vaccinate a family, are we submitting a charge for the actual vaccine as well as the appropriate vaccine administration code like we normally would for any other vaccine? Is that the correct procedure? Or are we just doing, since we're getting the vaccine from the state, are we only billing a vaccine administration fee? There's been some question and confusion about that.
This is Bobby. I can take that. And so you will be receiving the vaccine at no cost. Therefore, you can bill for the administration fee, but not for the vaccine itself.
Perfect. So it would just be the appropriate vaccine administration code that
That's
we
correct.
would normally do. And Dr. Chamberlain just chimed in that is he also concurs with that. So thank you. Question, I'm going to pull back. I'm going through the chat box. There was a question about, these next couple of questions have to deal with storage, which is obviously a little bit different than some of the other vaccines that we're used to dealing with. If you are using the ultra cold storage units that the vaccines are shipped in and following guidelines for dry ice replenishment, does that still require the temperature monitoring that you so eloquently went through?
Yes, it does. Yes, it does. You need to monitor that temperature. If you receive a shipment from Pfizer, it will have a temperature monitoring device that is appropriate for the ultra cold storage. So you will have access to that. You do not have to use that ultra cold thermal shipper though. You can store it in a regular freezer and you can store it in a refrigerator.
Great. So that's really, and we got a question on that and get a little bit of confusion. And if you wouldn't mind just sort of walking through, so how long is the vaccine good in the freezer? How long is it good in the refrigerator? And then once you tap that vial and you take out that first of 6 doses, how long? Do you mind just kind of re-clarifying and stating those timelines?
Sure thing, no problem at all. Your vaccine will arrive in the ultra cold storage container. It can stay in that ultra cold storage for 30 days, no problem. You don't have to do anything with it at all. Leave it sit there. We don't want you to do that, but you can let it sit in that ultra cold storage, replenishing that dry ice every 5 days. Okay, once you move that vaccine into a regular freezer, that regular freezer temperature, you can keep that vaccine for 2 weeks. Okay, it can stay in that freezer for 2 weeks, no problem. Once you remove that vaccine, you can put it in a refrigerator. In that when that moment you move vaccine from the freezer to the refrigerator, you have 120 hours. So you want to make note of the time that you take it from the freezer to the refrigerator, because it says 5 days, but it's up to 5 days. So that means 120 hours. Now, when you reconstitute the vaccine, you've got to use that, you've got a 6-hour time window. Okay, once you have it mixed, you've got 6 hours to use it. Use it or lose it.
Great. And then a follow-up question to that. There was a question, if you're, say you're doing a vaccine clinic and you know you're going to have patients one right after the other, are you able to draw up all 6 doses out of the vial at one time and use them over the next hour?
Yes, you can do that.
Great, thank you. Going back to the coding issue, there was also Dr. Baldwin had put in that there are separate codes for the first versus the second dose of the Pfizer vaccine. And we can see, Bobby, we can see if we can get those codes. Actually, Dr. Chamberlain put those in the chat as well, and we'll get that chat out to you. It's basically 1A and 2A with 3 zeros before all of those. I'm scrolling through the chat box. I just kind of wanted to remind everybody, I think the newest piece that I think I learned today was in the beginning when Deputy Director Himes had mentioned that we can order as little as 30 doses at a time. Bobby or Antoinette, is there a maximum number of doses? Is that going to be a maximum of 120 doses a week? If a practice has a clinic set up or they want to set up a clinic, can they get more vaccine if they need it? Or is 120 going to be the maximum?
Hi, this is Sarah DeWade from the Ohio Department of Health Immunizations Program.
Sarah.
There isn't a maximum at this time. We are, of course, happy to work with you if you have an outreach clinic you'd like to perform and need a certain amount of doses. We can certainly, you can contact our provider line and we'd be happy to try to get those doses out for your needs.
Great. And then we'll automatically, once we hit that, after we've completed our first 3 weeks and that first cohort's ready for their second dose, will ODH automatically then include that in our shipment plus additional vaccine doses?
That's a great question. So right now, we are pushing vaccine out to all providers except for, as the director talked about, local health departments and hospitals are doing piloting, ordering within the system. So right now, how it operates is we send you the first doses, and yes, automatically we would send you the second doses, so you wouldn't have to put a request in for that. When we move to online ordering, that might look a little differently, and we would have some information to share with you on how to do that once we approach that phase.
Great, thank you. couple more questions. I know we're a few minutes after 6 o'clock. If you all have a few minutes, ODH, to stick around, that would be great. I think we're kind of getting near the tail end of the questions. There was a question going back to the drawing up all of the doses in a single vial at one time. Would you recommend that once they're reconstituted, should they, oh, I'm sorry, let me rephrase that question. So after that vial is reconstituted, if you are only pulling out one dose at a time, should the vial be put back in the refrigerator between doses, or could it be left out at room temp? And if so, for how long?
It is okay to put it back in the refrigerator. You do want to have time to allow for that vaccine to come to room temperature. You don't want to give someone a really cold shot. That's very painful. You do have to use that. If you set it out and leave it out at room temperature, you only have 2 hours. So it cuts down the viability of that vaccine.
Great, thank you. And I'm assuming as long as the request is not unreasonable, where you're asking for 10,000 doses at a time, that really ODH is really committed to working with practices to try to either get them as little or as much vaccine as individually as the practices need. Is that correct?
Yes, absolutely. We will work with you as to
Great.
what your
And there was a
needs
question
are.
about how long does it take for ODH to review the application, and Sarah responded that the review of the application should take about 1 to 2 days. So if I know many practices have gone through the registration process but have been hesitant until today to hit the go button, it's, you know, waiting for that down to age 12. For those practices that have gotten that have done the registration process and really we're just waiting to hit the go button, how long would it be if our nurse manager or our managing partner hits that button tonight? How long would it be before those practices would receive vaccine?
That's a great question. So right now our enrollment team has reached out to all enrolled pediatric practices to go as soon as the ACIP approval or not. So we do have that documented in our system, and we've gotten that to the allocation team. So you could get it as early as next week's allocation if you indicated you wanted to be turned on automatically. If you decided, hey, I do want to be on the list, we can try to get you on it if you contact us fairly short. And then if not, we can try to get something transferred over to your practice.
Great. All right. Well, I think that wraps up all of our questions. I just want to thank all of our guests from Ohio Department of Health, Bobby, Antoinette, Sarah, and Deputy Director Himes, who had to step off to be on a call with the governor. And for those of you that have not multitasked and been keeping up with Twitter, some big news from the governor's office regarding state mandates. So when you're done with this, you definitely want to take a look at that. Please, again, the chapter has been very happy to work with ODH, and really the result of our members' questions and ODH's response is really what led to this webinar. And so please, Antoinette put up some contact information. We will get these slides out. Please do not hesitate to reach out to ODH as well as the chapter and utilize the Ohio chapter AAP practice management listserv, and we will get those questions to ODH and get those answered. We will get these slides as well as we're going to cut and paste the chat with some question and answers, and please keep this conversation going. Let us know your successes. Let us know any struggles or barriers you're having. I'd like to thank everybody for taking some time tonight to really try to get vaccines into their offices for kids. And I wish everybody a good evening. Thanks for spending some time with us, and have a great night.
Thank you.
Thank you, everyone.